Hi, this is Teacher Jerell. Dito sa Sandbox Clinic, Clark, three yung positions na pinufulfill ko. No? First, I'm a pediatric physical therapist. So, I work with kids with autism spectrum disorder and also for kids with physical dysfunction tulad ng cerebral palsy at saka Down syndrome. Also, as of the moment, ako din yung head ng physical therapy department. So, ano naman yung ginagawa ko dun sa position na yon? I work with my fellow pediatric physical therapist in planning and implementing their programs para sa mga pasyente nila. Minimake sure namin na lahat ng treatments na binibigay natin sa mga kids ay according to evidence-based practice. And third, ang role ko naman ay ang pagiging president ng Sandbox Clinic, Clark. For me, as the president, I'm one of those who sets the direction of the clinic in terms of partnership, creating programs, not just for our kids, but also for the community. As the head of the physical therapy department, I work closely with the other department heads such as the occupational therapy, speech therapy department, plus yung special education department. Ang goal namin dito sa Sandbox Clinic, Clark, ay i-foster talaga ang interprofessional collaboration dahil naniniwala kami na bawat isa't isang professional ay may i-contribute doon sa overall progress at positive outcomes ng mga patients na kinikater namin. We think and we feel that we have the moral obligation to promote and to protect the interests not only of the kids but also of the other professionals. Gusto namin ma-realize ng bawat isa't isa sa amin na hindi mag-i-improve ang outcome ng isang bata gamit lang ang isang professional. Dapat tulong-tulong, dapat sama-sama. Kasi merong mga ibang areas na may specific professional na makaka-target doon. So that is what Sandbox Clinic, Clark is pushing for. At nakakatuwa kasi naging maganda yung reception and yung response ng mga parents, ng mga kids na pumupunta dito sa Sandbox Clinic, Clark. Kung paano namin pininiwalaan, kung paano namin in-envision ang interprofessional collaboration, unti-unti, ganun na din yung paniniwala ng mga parents. And we see excellent outcomes. Here at Sandbox Clinic, Clark, I led the development of the Sandbox Clinic, Clark service delivery model. Doon sa model na yon, central to our practice is the patient outcome. At para ma-achieve namin yung excellent and positive patient outcome, we've identified 4 factors to target. Number 1 is research and evidence-based practice. Kagaya nung na-mention ko kanina, lahat ng treatment na binibigay namin sa mga bata at sa mga adult na patients ay according to the best evidence. At of course, kailangan namin i-consider yung preference ng family at ng patient kung gusto ba nila at acceptable sa kanila yung treatment na yun. Before we implement, we always ask for their consent. We give them options. We have to inform them. At least kung magde-decide sila kung tatanggapin nila yung treatment na in-offer namin sa kanila according to evidence, inform yung decision-making nila. Second is community reintegration or community integration. Hindi lang after ang Sandbox Clinic, Clark, na ma-discharge yung client sa care namin. Gusto namin after discharge from the clinic or habang ongoing yung kanyang treatment sessions dito sa Sandbox Clinic, Clark, unti-unti na-i-integrate siya doon sa community na kinabibilangan niya. Meaning, kaya niya nang makisalamuha sa mga kalaro niya, kaya niya nang pumunta sa community kung nasaan siya. For example, sa playground, sa village nila, maka-attend ng mass kung nagsisimba man sila, or makapunta sa groceries, or makapunta sa mall. Gusto namin ma-realize nila na despite their conditions, despite their diagnosis, marami pa rin silang magagawa. Third, we have the caregiver empowerment. Ang therapy session kasi 1 hour lang siya. So yung remaining 23 hours na kasama ng parents ang bata at home, very important. And we want the parents to realize na more than the therapists, mas malaki ang naiko-contribute nila doon sa development ng mga kids. Nandito kaming mga therapists to guide them, but we have to make them realize that after the treatment sessions, sila yung in charge doon sa well-being ng mga kids nila. And then fourth is the interprofessional collaboration. As I've mentioned earlier, gusto namin, we want everyone to get involved doon sa care ng mga bata na merong pangangailangan for rehabilitation or habilitation. Gusto namin na ma-realize ng lahat na may maiko-contribute ang bawat isa't isa. Na hindi kayang i-target ng isang therapist lang ang pangangailangan ng isang bata. But of course, before we do the interprofessional collaboration, kagaya ng lahat ng mga practices, kailangan muna namin i-examine, kailangan muna namin i-screen yung bata para malaman talaga namin kung ano yung mga pangangailangan niya. At kapag na-identify na namin kung ano yung mga pangangailangan nila, ini-involve namin yung mga dapat na i-include doon sa rehabilitation process.